Besides being an expert in proton therapy, Dr. James Metz is also the editor-in-chief of OncoLink, perhaps the leading oncology website for patients. We had questions for him about what impressed him at the ASCO meeting.
Well, I think globally, when we look at the news from ASCO, it's really about continued development of personalized medicine, coming up with ways to target unique molecular abnormalities in patients and testing those patients ahead of time to try to figure out, is this therapy going to work in this group of patients? You know, right in the past, we've used a shotgun approach where, well, the bulk of patients this may work in, so we'll use this therapy. But now we're seeing more and more where we're testing molecular markers in patients and knowing beforehand whether or not this therapy is worth using in those patients. And that's really the way that I see medicine going, is this personalized approach. And we're really seeing more and more of that at each ASCO meeting. Well, I think more and more we're seeing that as patients are doing better, we're seeing more and more long-term survivors. In the United States, we have over 12 million cancer survivors now, that once they finish therapy, what's next? We know that many of these therapies we deliver cause side effects, not just right then when they deliver the treatment, 5, 10, 20 years down the road. And what types of things do they have to think about as they go forward? So there's a big movement in the United States right now that is gathering traction to make sure patients have the information they need for their long-term survivorship care. So we've developed a program called the Live Strong Care Plan at OncoLink in the University of Pennsylvania, and partnered with the Lance Armstrong Foundation to deliver this information personalized to patients. They can actually go on the web to livestrongcareplan.org, put in some basic demographic information about themselves, and generate a care plan instantly for themselves so they find out, what are my risks long term, what kind of things should I think about. And actually, since we launched this product, we've actually had over 15,000 patients create care plans for themselves. So we're very excited about this, and we're seeing a lot of excitement here at ASCO, where more and more people are learning about the care plans and want to get them out to their patients.